telling that acuity story is going to be very impactful to the administrative leadership, to be able to go a navigation program to get in front of their leadership and state, here's a validated tool that is showing how we're driving care and outcomes for our patients and where we're spending our time. We need additional support with navigation FTE to continue to manage the needs of our patients. That's very powerful because it's measurable and demonstrates the impact navigation is having on clinical practice and patient outcomes.
Yeah, and we've really married this with the metrics. So the 35 evidence-based metrics, again, evidence-based is so important. So that has really been sustainable. This is the next step because after we had the metrics, we're like, okay, now let's look at an acuity tool. And it's got to be evidence-based and it's got to be validated. One of our colleagues said, guess what? If it's not, it just ends up in the pile of all those other tools that were not successfully validated. So that's why it's so important, because administrators, especially through COVID, have been like, what's the ROI on my program? We're starting to see more programs have metrics in place, which is wonderful. We're thrilled. But now looking at an evidence-based acuity tool for navigation, that is just, it's just, you know, we're thrilled and it's so needed. So we're very excited.
It's going to empower navigation programs to be able to tell their story. When you look at value-based cancer care, it has to be measurable. So to be able to go back to your C-suite and say, here's the data. Here's how the navigation program is impacting patient care and their outcomes. That's a powerful story and is going to give the support navigation programs need to grow and provide the care and services we desire for
patients. And the timing is great because in July of 2023, they're enhancing the OCM model. It's going to be called Enhancing the Oncology Model, which is wonderful. And navigation is right in there again. And it's all about quality outcomes and looking at, you know, barriers to care and how we can support our patients and make our programs better and stronger earlier in the continuum. So looking at our patients' acuity and the navigation acuity is super, very, very important. So yeah, timing's great.